Great to have you here at the Nuffield Trust Annual Health Policy Summit. And I've got some questions I'd like to put to you about the whole issue of how the voluntary sector can work with the NHS in trying to improve services for people.
Great.
So I wonder if, first of all, you could talk to me a bit about how do you actually see good care for people with long-term conditions such as multiple sclerosis? What would that care be like?
Well, people with multiple sclerosis and other long-term conditions are very clear about how the system isn't working and what they think good care is. So, firstly, they often say they have to be pushed around the system. There isn't a central person who can help coordinate their care, and they're often telling the same story to multiple professionals. That's frustrating, time-consuming, and they feel waste money. What they want to see and want to have often is one person who can help them navigate what can be a complex system so that they're getting the best clinical outcomes, but importantly getting the best care and support in their communities when they leave hospital, and getting the right information, advice and support to take control of their own condition and self-manage better. The second thing they say isn't working is really about support specifically for self-management. They often say they know their condition, they know what they're feeling much better than the clinicians and the specialist nurses, but they lack the information, the advice, perhaps the apps, the products, to really take control of their condition in a way that improves the quality of their lives.
Well, you clearly have a very strong sense and understanding of what it is that people with long-term conditions like MS want in terms of their care and how it's coordinated. How then do you, as an organisation representing patients, how do you work with the NHS to put that into practice, that approach to care?
Well, at multiple levels. I think part of what we do as an organisation is present a very clear evidence base, firstly about the access and the quality of care that people with MS are experiencing. And what we know is that access to care is very poor. It's one of the lowest levels in Europe. And the quality of care is incredibly variable. And this is a story that's common across the NHS and the social care sector for people with different conditions. So we have a role in presenting the evidence, but also a voice for those people to tell their stories and say what the experience is.